All right, so welcome back to edition number 2 of our little roundtable chat here. We're going to stay on the ACL conversation. As I'm sure you can tell by our wardrobe, either we're recording a couple of these at a time or we only have one outfit each. So we want to sort of go into some of the different things we see from a rehab perspective or a post-operative perspective after these things happen. And so one of the things we often get questioned a lot about is we're going to break this up into two different questions, but either should I do PT or rehab or strengthening prior to my surgery, and how soon after my surgery should I start? So why don't we just kind of go around and we'll take the first one. What do you like people to be doing prior to surgery? You know, you fall, there's a pop, something happens. What should you do? What should you do next?
I'll let you take this one since I took the last one.
All right. So if you feel a pop, one of the first things is to get evaluated. I think that, you notice your knee's swollen, you have black and blue. A lot of us, whether it's an AT, a PT, or even your local ortho, we can kind of say, hey, you know what, this is what we think is going on, and this is what I think needs to happen next. So really get evaluated by a, like I said, AT, PT, or ortho. We can kind of say, hey, you know what, I think you might have torn your ACL just by some hands-on testing we do. And then we'll send you off to the ortho, or they'll send you off for an MRI to kind of dictate, hey, you know what, we need surgical intervention or not. So in regards to kind of what happens next, that's it. And then after that, then we potentially start the prehab process, which I think all of us here think is an important part. To get back to playing, after surgery, or just get your rehab process started after surgery a little bit better, and you're not lagging.
Yeah. I think that pre-injury, that pre-surgical strengthening, also, a lot of the, this isn't only coming from us, like obviously we have a bias towards that sort of thing, but a lot of the surgeons I talk to and sort of interact with on a regular basis, one, they don't want to operate on you without full range of motion.
Yep.
They don't want a ton of, listen, they're going to go in there and they're going to cut stuff with really sharp tools. Hopefully they're sharp. And they're going to, it's a major surgery. You're going to lose some strength from that. If you already have a little bit of a strength loss right away, then, there's going to be that, you're going to be sort of that much more behind the 8 ball afterwards. And so they want you doing it too. It's not just us from our side saying, we want to get you in the clinic and we want to get you doing this.
Yeah. It's not the loss of the ACL that causes a decrease in strength. It's the disuse, it's the swelling. So the biggest thing in the world is getting that swelling out of there, maintaining strength as much as possible. That's, that's going to be huge. It's also going to make your job a lot easier post-operatively. I guess last thing I'll say too is don't even be afraid to get more than one opinion. I'm speaking from personal experience. I've evaluated ACLs on the sideline that I would have bet my money that were not torn. They had no positive tests on the standard orthopedic tests that we go through, but you have so much muscle guarding at the time that sometimes you can't even tell right away. So, get it looked at as soon as possible, just like Ashley alluded to, but then also wait a few days and go back to that same person so that you have good reliability between the person who's testing you, and get it tested again, and stay on top of that for a good week or two. And if somebody tells you that you're fine but something feels off, go get a second opinion, go get a third opinion. Don't be afraid to seek out those resources, to find a specialist who does this kind of stuff day in and day out. That's going to really be the big determining factor for you guys.
I've been in that situation that John talks about with the ACL and the false, false positive almost. I tore my ACL and they told me, hey, you know what, I don't think anything's wrong, go back out and run. Now, me knowing my body, I decided to kind of sit back and say, hey, you know what, I don't think it's a good idea. And come to find out, 3 days later, I did tear my ACL. So it's just kind of going back to that. Don't be afraid to get it looked at. Don't be afraid to get more than one opinion. And, use your best judgment and know your body.
You know the best.
You know the best.
My grad school roommate actually tore his ACL. He was playing collegiate soccer at the Mount. He had it torn for his whole season, and he didn't know it. But after every game, it swelled up on him, it was painful. He just managed that and then played the next game. So, take those little things into account. Like she said, you know your body best.
All right, so then, sort of go into kind of like the second part of this question. So you tear it, you have this inevitable surgery. From a post-operative rehab standpoint, how soon are you guys looking to get people into the clinic and start working with them?
ASAP.
Yeah.
Like right away. It's the sooner we get you in, typically the better we get your range of motion. We can get the swelling down a little bit faster, and we just get to working with you faster, which then leads to a better recovery in the long run.
Yeah.
You know.
Some of the first things I like to talk about, even though you won't be doing much activity, and you probably haven't been doing much, is educate, educate, educate. I want you eating more because you're probably eating less than you were. Just because you're not as active, it might not be as hungry, but your body needs to heal. So we get you doing upper body stuff. We get you doing as much lower body stuff as you can to get those muscle contractions back. I mean, even if it's a joint replacement, right, guys?
Yeah.
We're getting people walking that day. So you have an ACL reconstruction, provided that your surgeon didn't do anything unforeseen, we should get you walking and weight bearing as much as you can to stimulate bone growth, muscle growth. But I like to educate people on proper nutrition. Eat lots of peanut butter unless you have a nut allergy, but you want to get those good calories in. So those are the kind of things I like to do on top of the basic phase 1 protocols.
I think that's a big thing. John hit on a big thing, is this idea of, you're an athlete and your body's used to training, it's used to doing all these things. The last thing you want to do is be sitting around. You may have torn your right or your left ACL, whichever. You've got an opposite leg, you've got 2 good functioning arms. There's a lot that you can be doing training-wise, workout-wise, and all that stuff. And really, that's going to speed the healing of your knee. I always joke around with people that the first exercise you should do after you tear your ACL is a bench press. And you can, we're not looking for, heavy weights. You're probably not going to enter a powerlifting competition. But I want to get you training, working out, moving on a daily, regular basis, because that's what your body's used to, and that's what's going to help you recover the fastest, is getting back.